Welcome to Master the Beat, from basic EKG to life-saving ACLS. This is episode 3, Waveforms Unveiled, Mastering Intervals and Segments. In this episode, we're diving into the rhythm of the heart itself, its waveforms, intervals, segments, and complexes. Think of it as learning a new language, the language of the heart's electrical activity, where each peak, dip, and flatline tells you a vital story about what's happening inside, whether it's the subtle rise of a P wave or the sharp spike of a QRS complex. Understanding these elements is key to mastering ECG interpretation. So let's tune in to the heart's rhythm and start decoding the signals that keep life ticking. Although this is not an exhaustive list, it's important to highlight a few of the most common misconceptions rooted in racial essentialism within cardiovascular medicine. It's been long assumed that African Americans are biologically more prone to hypertension and heart failure. However, recent research emphasizes that environmental, social, and economic factors, rather than race, is the focus when analyzing these health disparities. Another significant issue is the use of race in cardiovascular disease risk prediction models. As Warwick et al. Discuss, including race in these algorithms perpetuates the flawed belief that race is a biological determinant. This practice also leads to biased clinical decisions. Finally, socioeconomic status is a major determinant of cardiovascular outcomes, always more significant than race itself. Research shows that differences in heart disease between Black and white patients are largely attributed to socioeconomic status rather than racial differences. For example, studies found that in low socioeconomic status areas, life expectancy differences between Black and white patients with acute myocardial infarction were minimal, underscoring the importance of socioeconomic factors. These insights remind us that addressing health disparities requires moving beyond racial essentialism and focusing on real determinants of health such as socioeconomic conditions and access to healthcare. In our previous episode, we emphasized the importance of the P wave, QRS, and T wave in ECG interpretation. Now let's find out why. Let's get started with the P wave. The P wave is the first deflection, marking the beginning of the cardiac cycle. This wave represents atrial depolarization, hence the atria to contract, pushing blood into the ventricles. The P wave starts as it departs from the baseline and concludes as it returns to that baseline, creating a smooth and rounded appearance in a normal ECG. A normal P wave originating from the pacemaker cell, the sinus node, is typically smooth and round and is positive in lead 2, one of the standard leads we use in ECG interpretation. For a normal rhythm, there should only be one P wave preceding each QRS complex, which indicates that the atria are functioning correctly in tune with the ventricles. However, abnormal P waves can signal a variety of atrial conditions. An inverted or negative P wave might suggest an abnormal conduction pathway, while absence of a P wave could indicate an issue with atrial depolarization. If you see more than one P wave for each QRS complex, or if the P wave appears wide and notched, it may be a sign of left atrial hypertrophy. Conversely, tall and peak P waves could indicate right atrial hypertrophy. Other abnormal patterns include flat, small, and pointed waves, or more distinctive sawtooth and wavy appearances, which could indicate various forms of atrial arrhythmias like AFib or A-flutter. Recognizing these variations in the P waves is crucial for diagnosing underlying cardiac conditions and guiding effective treatment. Would you like to see the different P waves we just reviewed? I've got examples of all of them, along with explanations for every one and why it's abnormally shaped. Please subscribe to our channel and gain access to dozens of practice questions and EKG strips that I provide after each episode to help you master every heart rhythm. As a member of Novamind, I'll share with you the methods I've perfected over the past 20 years as a critical care nurse, ICU educator, and acute care nurse practitioner. If you're struggling with EKG interpretation, I can simplify it for you using the quick, effective techniques I've taught to thousands of ICU nurses and residents who continue to use them today in their practice. Pause to read how to become a member of Novamind LLC for only $5.99 a month. Prices are subject to change. Understanding the PR interval is also crucial for interpreting ECGs in critical care settings. The PR interval provides important information about the electrical conduction pathway from the atria to the ventricles, and any deviations from the norm can indicate underlying cardiac issues that require immediate attention. Let's break down what the PR interval represents. The PR interval includes both the P wave, which signifies atrial depolarization, and the PR segment, the flat line that follows the P wave before the QRS complex begins. This interval is measured from the start of the P wave as it departs from the baseline to the beginning of the QRS complex. Normal PR interval in a healthy heart, the PR interval should measure between 0.12 to 0.20 seconds. This duration reflects the time it takes for the electrical impulse to travel from the SA node through the atria, the AV node, and then the bundle of hits, and finally into the ventricles. A normal PR interval indicates that the electrical conduction system is functioning properly, allowing coordinated and timely atrial and ventricular contractions. The QRS complex is one of the most critical elements of the ECG, representing ventricular depolarization, the process by which the ventricles are electrically stimulated to contract and pump blood out the body. This complex is made up of three distinct wave deflections. These wave deflections are the Q, R, and S. The Q wave is the first negative deflection that occurs before the R wave. The R wave follows as a positive deflection. The S wave is a negative deflection that comes after the R wave. The QRS complex is measured from the point where it begins to leave the baseline, the start of the Q wave, to the end where it levels out into the ST segment. The point at which QRS complex meets the ST segment is known as the J point or junction point. This is important. Don't forget this point. The normal QRS complex is usually predominantly positive in lead 2 and has a duration of 0.10 seconds or less, reflecting a healthy, efficient electrical conduction through the ventricles. On the other hand, an abnormal QRS complex is characterized by a widened duration of 0.12 seconds or more. This widening typically indicates that the electrical impulse is either originating from a pacemaker site within the ventricles or encountering a block in the bundle branches. Such abnormalities can signal significant underlying cardiac issues that require prompt attention. The ST segment plays a crucial role too in ECG interpretation. It represents the early stages of ventricular repolarization, the process where the ventricles begin to recover after depolarization. The ST segment is seen as a flat line on the ECG, tracing position between the end of the QRS complex and the beginning of the T wave. A normal ST segment lies flat along the baseline, indicating that the ventricles are repolarizing uniformly. However, an abnormal ST can provide important clues about underlying cardiac conditions. ST elevation, ST segment is elevated 1 millimeter or more above the baseline. It is often a sign of an acute condition such as ST elevation myocardial infarction, which is called a STEMI, or pericarditis. ST elevation requires immediate medical attention as it usually indicates a critical issue with the coronary artery blood flow. ST depression. Conversely, if the ST segment is depressed 1 millimeter or more below the baseline, typically points to a non-ST elevation myocardial infarction, or the non-STEMI, or myocardial ischemia, both of which reflect insufficient blood flow to the heart muscle. The PR segment is commonly used as the reference point to assess whether ST segment is elevated or depressed relative to the baseline. This comparison is essential for accurately diagnosing these serious cardiac conditions. For exercises with Tips on how to interpret and treat these abnormal ST segments, make sure to become a member of Novamind LLC. Being able to recognize and interpret changes in the ST segment is vital for any critical care provider or RN, as it directly impacts the diagnosis and treatment of life-threatening cardiac events. Accurate identification and quick response to these changes can be the difference between a timely intervention and a missed opportunity in critical care. Next is the T wave. The T wave on an ECG is another crucial component representing ventricular repolarization, the phase where the ventricles recover and prepare for the next heartbeat. The T wave begins as the deflection moves away from the baseline, and then it ends when it returns to the baseline. In a normal T wave, you'll observe a round and slightly asymmetrical shape. Typically, the T wave has a gradual slope as it ascends to its peak, followed by a more abrupt descent back to the baseline. In lead 2, a standard positive lead, the T wave should be positive, reflecting normal ventricular repolarization. However, an abnormal T wave can manifest in various forms, such as being unusually tall, flat, biphasic, having two peaks, or inverted. These abnormal T wave shapes can be indicative of serious underlying conditions. And finally, the U wave, which is a small deflection that sometimes appears on the ECG following the T wave. Although it is not always present, the U wave is thought to represent late repolarization, likely of a small segment of the ventricles. It begins as the deflection leaves the baseline after the T wave and ends when it returns to that baseline. A normal U wave is typically small, measuring 2 millimeters or less in height, and is round and symmetrical. In lead 2, where the U wave is most easily observed, it should be positive. This wave is best seen when the heart rate is slow, making it easier to distinguish from the preceding T wave. However, an abnormal U wave can provide important clinical information. For example, a tall U wave defined as greater than 2 millimeters in height is commonly associated with hypokalemia, a condition characterized by low potassium levels in the blood. The QT interval is a crucial measurement on the ECG that represents the entire time span from the beginning of ventricular depolarization to the end of ventricular repolarization. In simpler terms, it reflects the period during which the ventricles are contracting and then recovering before the next beat. To accurately measure the QT interval, you begin at the start of the QRS complex where ventricular depolarization occurs and extend to the end of the T wave, which marks the completion of ventricular repolarization. However, it's important to note that the QT interval can only be reliably measured if the heart rhythm is regular for at least 2 cardiac cycles prior to taking the measurement. A normal QT interval is generally less than half the R to R interval, the time between the 2 consecutive R waves. This proportion ensures that the ventricles have sufficient time to contract and repolarize before the next beat begins. A prolonged QT interval is of significant concern because it increases the risk of life-threatening arrhythmias, particularly in the ventricles. Various factors can contribute to prolonged QT intervals. QT interval prolongation is a critical concern in cardiac care because it increases the risk of potentially fatal arrhythmias like torsades de pointes. Understanding the common causes of QT prolongation is essential for preventing these dangerous outcomes. Don't miss our members only episode where we dive into how to measure QT intervals, identify causes, and explore effective treatments. The QTC interval is an important adaptation of the QT interval corrected for heart rate. This correction allows for more accurate assessment of the repolarization period across different heart rate, which is critical in clinical settings where heart rate can fluctuate significantly. QTC and heart rate relationship. The QTC interval is inversely related to the heart rate. As the heart rate decreases, the QTC interval increases. This prolonged QTC can make the heart more susceptible to dangerous arrhythmias, particularly when the heart slows down. Conversely, as the heart rate increases, the QTC interval shortens. This adjustment helps maintain a balanced and safe period for ventricular repolarization as the heart beats faster. Prolonged QT-QTC intervals. The prolonged QT and QTC interval is especially concerning because it lengthens the heart's refractory or vulnerable period during repolarization. This extended period increases the heart's susceptibility to dangerous arrhythmias, particularly torsade de pointes, a potentially fatal arrhythmia characterized by a rapid, irregular heartbeat that can lead to sudden cardiac death if not promptly treated. At Novamind LLC, our core values are firmly aligned with the American Medical Association's policies, which assert that there is no biological evidence of race and it is a social construct. We adhere to the AMA policies that advocate for the elimination of race as a proxy for ancestry, genetics, and biology in medical education, research, and clinical practice. This is why Novamind sets itself apart as the pioneer in health equity education and professional development through our unwavering commitment to these principles. Every course we create is designed to identify and challenge the ingrained biases that have historically influenced and continue to affect healthcare today. Our approach is not just about delivering content, it's about transforming, understanding, and establishing new guidelines for educating healthcare professionals. And that brings us to the end of episode 3 in our Master the Beat from Basic EKG to Life-Saving ACLS series. Today we broke down the essential components of the ECG waveform, waveforms, intervals, segments, and complexes, giving you the foundational knowledge needed to accurately interpret an ECG. But we're just getting started. In our next episode, Rhythm Recognition, the essentials of strip analysis, we'll dive deeper into how to recognize and analyze different heart rhythms, a crucial skill in both emergency and in everyday clinical settings. Make sure to like, subscribe, and hit the notification bell so you don't miss out on the vital training. If you're a member, remember to check out exclusive content we have just for you, including practice strips and in-depth tutorials to solidify your learning. See you in the next episode. Note, there will be a following reference and the AMA policies. Please pause to read.